Hello ladies and gentlemen, please contact Professor Robert for a customized paper of the following or any other assignment. BHA-FPX 4002. Historical Trend Analysis. Write a 2 to 3 page trend analysis paper to describe healthcare regulations and medical practice, evolutionary changes for access, quality, and cost, including the significant milestone events for different time periods. Mona is a newly appointed quality reporting analyst for a Northeast Accountable Care Organization, ACO. Her director tells her that the U.S. healthcare system is going through a quality revolution. The drivers of this movement are years of proposed, failed, and enacted legislation, many regulatory agencies lobbying for change, and the myriad of quality initiatives implemented before and after the Affordable Care Act. Other influences in this trend are Medicare, Medicaid, employer groups, and the managed care market's drive to improve quality and reduce costs. The beneficiaries of these plans' patients want transparency of their services in regard to quality, safety, and cost. To achieve these desired health service outcomes, private and public health systems work in tandem to reduce the burden of disease and increase quality, while managing costs. They do this through programs such as Vaccines for Children, VFC, and Women, Infants, and Children, WIC, the Substance Abuse and Mental Health Services Administration, SAMHSA, Healthy People, 1990-2030, Program of All-Inclusive Care for the Elderly, PACE, and many more. Mona's director shares with her that all of these private public health programs and initiatives, in addition to the significant advancements in medical education, research, and technologies, have led to one of the most highly regulated industries in the United States and the world today. In this assessment, you will review the private and public health legislation, regulatory agencies, and quality initiatives that have catapulted the United States into the quality revolution that we are experiencing today. As this quality revolution continues, healthcare professionals can expect to see more innovations contributing to individual patient and population health quality initiatives, with many more regulations to come. Scenario: you are a healthcare educator for a large integrated accountable care organization, ACO. You are tasked to work with a group of hospital executives to identify milestone events for 3 years, the 1800s, 1900s, and 2000s, and identify trends from those events that impacted the healthcare industry. The trend analysis will consist of 3 critical measures: access, quality, and costs. Milestone events and trends identified for these 3 measures over time should include legislation, regulatory agencies, and quality initiatives in the various time periods. The final paper will be used in an annual strategic planning session attended by the ACO and hospital executives to demonstrate how the quality movement has evolved into a quality revolution. References: Young, K.M. and Croth, P.J. 2018. Sulz and Young's Healthcare USA. Understanding its Organization and Delivery, 9th ed. Jones and Bartlett Learning. Available in the course room via the Vital Source bookshelf link. Chapter 11, Public Health and the Role of Government in Healthcare, pages 301-349. Chapter 13, Future of Healthcare, pages 371-390. Healthcare Quality Evolution Milestone Events Chart DOCX. Study the events on this timeline to determine trends in access, quality, and cost of healthcare throughout history. You will use the milestones on this timeline to research and write your assessment. Chan, D.C., Hune, J. and Studdard, D.M., 2019. Accuracy Evaluations of Surgical Procedures in the Medicare Fee Schedule. The New England Journal of Medicine, 380-16, 1546-1554. Though this article explains resource-based relative value scale based on relative value units, RVUs. It outlines physician work RVUs, practice expense RVUs, and malpractice RVUs, and discusses room for improvements in this system. Deckern, S., Patrick N. O'Farrell, Elaham, S. and Archangel, R., 2019. Impact of Repeated Hospital Accreditation Surveys on Quality and Reliability, an 8-year interrupted time series analysis. BMJ Open, 9-2. Though this is an 8-year accreditation study of hospitals that demonstrate improved quality measure outcomes. Spear, M., McCullough, J.M., Fielding, J.E., Faustino, E. and Tuch, S.M., 2020. Excess medical care spending. The categories, magnitude, and opportunity costs of wasteful spending in the United States. American Journal of Public Health, 110-12, 1743-1748. Though this resource contains several reputable landmark reports of hundreds of billions of dollars wasted in the United States on medical care every year, with no improvements of health outcomes. It discusses 6 categories: clinical inefficiencies, misprevention opportunities, overuse, administrative waste, excessive prices, and fraud and abuse, and CQA, and D. Headis and performance measurement. https://www.ncqa.org/headis/. Though this website shows NCQA accreditation for managed care organizations, MCOs, and Headis quality reporting to demonstrate the MCO population health status. The Joint Commission. And D. Accreditation Basics for Beginners. https://www.jointcommission.org/accreditation-and-certification/health-care-setting/home-care-on-demand webinars home care accreditation basics for beginners. Though this website and video presentation show how accreditation is performed from beginning to end, including process, resources, and costs. Instructions. Write a 2-3-page paper in which you explain and analyze healthcare regulations and medical practice, evolutionary changes for access, quality, and cost, including the significant milestone events from different time periods. Complete the following. 1. Study the Healthcare Quality Evolution Milestone Events Chart (DOCX) to review the key regulatory or quality initiative events relative to the 1800s, the 1900s, and the 2000s. 2. The textbook is suggested as the most efficient resource for this assessment, or use at least 2 other resources from those provided with this assessment. You may also use resources you find on your own, from the History of Healthcare Research tab in the Healthcare Administration Undergraduate Library Research Guide to Research for the Trend Analysis Table. Evolution of Access, Quality, and Cost in Healthcare Table in the appendix of the Historical Healthcare Trend Analysis Template (DOCX). Though you are required to reference a total of 3 scholarly sources in your paper, though be sure to cite these references within the body of your paper correctly using APA-style citations. Refer to evidence and APA in the Capella Writing Center for help with using APA style. 3. Complete the trend analysis table. Evolution of access, quality, and cost in healthcare in the appendix for the assessment template. Though for each time period, select 2 milestone events or regulations from the Healthcare Quality Evolution Milestone Events Chart (DOCX) that have affected each topic. Access to healthcare, quality of healthcare, and cost of healthcare. Though there should be a total of 18 milestone events or regulations in the completed table. Though include bullet points with notes that describe each event or regulation and how it impacted access, quality, or cost. 4. Write an introduction for the paper using the Historical Healthcare Trend Analysis Template (DOCX). They'll provide a brief explanation of the purpose of this historical trend analysis and how it might be used in your work as a health administrator. 1 paragraph. But where appropriate, reference significant healthcare milestones, regulations, and measures for access, quality, and cost. Or refer to the writing support page on campus for resources to help you as you write and revise your paper. 5. Use the trend analysis table. Evolution of access, quality, and cost in healthcare table to write the body of your paper. They'll complete the trends and regulations section in the assessment template. They'll provide a brief description of the key measures of healthcare services, which are access, quality, and cost. 1-2 paragraphs. Though in the healthcare access subsection, explain the significant trends and regulatory milestones associated with access to healthcare over the recent years. 1-2 paragraphs. But what U.S. legislation, regulatory agencies, and quality initiatives from the 1800s, 1900s, and 2000s have influenced access to healthcare services in the United States. But what does your milestone trend analysis reveal for access to care? Though include citations and references to specific regulations, events, or agencies. Though in the healthcare quality subsection, explain the significant trends and regulatory milestones associated with healthcare quality over the recent years. 1-2 paragraphs. But what U.S. legislation, regulatory agencies, and quality initiatives from the 1800s, 1900s, and 2000s have influenced care quality in healthcare services in the United States. But what does your trend analysis reveal for care quality? Though include citations and references to specific regulations, events, or agencies. Though in the healthcare costs subsection, explain the significant trends and regulatory milestones associated with access to healthcare costs over the recent years. 1-2 paragraphs. But what U.S. legislation, regulatory agencies, and quality initiatives from the 1800s, 1900s, and 2000s have affected healthcare costs for medical services. But what does your trend analysis reveal for medical service costs? Though include citations and references to specific regulations, events, or agencies. Complete the trend analysis section of the assessment template, 1-2 paragraphs. Analyze the trends and regulations in healthcare access, quality, and cost to draw conclusions about the evolution of healthcare regulations and practice throughout the recent years. Describe professional experiences or examples to illustrate the trends. Include citations and references to specific regulations, events, or agencies. 6. Write the conclusion for the paper, 1 paragraph. Briefly restate the trends revealed for healthcare access, quality, and cost. Draw a conclusion about how the milestones, regulations, and changes have improved, been neutral, or inhibited progress of the U.S. healthcare system. Summarize clear and concise conclusions of your trend analysis. Additional requirements. Your paper should be 2-3 pages, in addition to the title page, appendix, and references page. Double-space your paper, and use Times New Roman 12-point font, as indicated in the assessment template. Use a minimum of 3 resources. This may include your textbook and other course resources. Complete all parts of the assessment template, using the headings provided in the template. Support all points with credible evidence, in the form of OPA citations. Include a references page in OPA format with appropriate citations. Complete the trend analysis table. Evolution of access, quality, and cost in healthcare in the appendix of the assessment template. Competencies measured. By successfully completing this assessment, you will demonstrate your proficiency in the following course competencies and scoring guide criteria. Competency 1. Analyze trends in the U.S. healthcare system from a historical perspective. Identify healthcare legislative, regulatory agency, and quality initiative events in a trend analysis table of different years. Competency 2. Explain the development of health regulation and the evolution of medical practice. Explain the significant trends and regulatory milestones associated with access to healthcare over the recent years. Explain the significant trends and regulatory milestones associated with healthcare quality over the recent years. Explain the significant trends and regulatory milestones associated with healthcare costs over the recent years. Analyze the trends and regulations in healthcare access, quality, and cost to draw conclusions about the evolution of healthcare regulations and practice throughout the recent years. Competency 4. Communicate in a manner that is scholarly, professional, and respectful of the diversity, dignity, and integrity of others. Appropriately addresses all components of the assessment prompt, using the assessment description to structure text. Apply OPA formatting to in-text citations and references.